There is a clock running right now. And most Americans turning 65 have absolutely no idea it exists. It started ticking the moment you became eligible for Medicare. And when it stops, when that window closes, the financial penalty that follows does not last a month. It does not last a year. It follows you every single month for the rest of your life. I am not talking about a small fee. I am talking about a permanent increase in your Medicare costs that compounds year after year after year, all because nobody told you about a deadline that the government does not advertise and your doctor will never mention. In the next few minutes I am going to show you exactly when that clock started, exactly when it stops, and exactly what you need to do before time runs out. Because unlike most mistakes in life, this one cannot be undone. Stay with me. And if you find this video valuable, please tap the like button right now. It helps other seniors find this critical information before it is too late for them too. Let us start with the first and most important enrollment window. It is called the Initial Enrollment Period. This is the 7-month window you get when you first become eligible for Medicare at age 65. Here is exactly how those 7 months break down. The window opens 3 months before the month of your 65th birthday. It includes your actual birthday month. And it stays open for 3 months after your birthday month. So if your birthday is in June, your initial enrollment period runs from March through September. 7 months total. During this 7-month window you can sign up for Medicare Part A, Part B, Part C and Part D without any penalty whatsoever. You simply apply, get approved, and your coverage begins. Clean. Simple. No extra charges. But here is where timing inside that window matters more than most people realize. If you sign up during the first 3 months, before your birthday month, your coverage starts on the first day of your birthday month. Perfect timing. But if you wait until your birthday month or the months after, your coverage start date gets pushed back. Sometimes by 1 month. Sometimes by 2 or even 3 months. Meaning you could be 65, fully eligible, and still have a gap in your coverage because you waited too long inside your own enrollment window. The lesson is simple. Do not wait until your birthday month. Sign up 3 months before you turn 65. That one action guarantees your coverage starts exactly when you need it with 0 gaps. Now let us talk about what happens if you miss your initial enrollment period entirely. This is the part that most people cannot believe when they first hear it. If you do not sign up for Medicare Part B during your initial enrollment period and you do not have other qualifying coverage, your monthly Part B premium goes up by 10% for every 12-month period you went without coverage. And that increase is permanent. It never goes away. It never gets reduced. It follows you for life. Let me put that in real numbers so you understand exactly what this means. In 2026 the standard Part B premium is $202.90 per month. If you missed your enrollment window by 2 years, meaning you went 24 months without signing up, your premium gets increased by 20% permanently. That is an extra $37 every single month. Every month for the rest of your life. Over 10 years that is $4,440 in extra penalties. For missing a deadline. And Part D has its own penalty too. For every month you go without prescription drug coverage after becoming eligible, you pay an additional 1% of the national base premium added to your Part D cost permanently. Again, for life. Just for being late. Now here is something that gives a lot of working seniors enormous relief when they find out about it. If you are still working at age 65 and you have health insurance through your employer, you do not have to sign up for Medicare right away. You qualify for what is called a Special Enrollment Period. The Special Enrollment Period allows you to delay signing up for Medicare without penalty as long as you are covered by employer-sponsored health insurance based on your own active employment or your spouse's active employment. The key word is active employment. Retiree health coverage does not count. COBRA coverage does not count. Only active employer coverage qualifies. When your employer coverage ends, whether because you retire, lose your job, or your spouse retires, you get a special enrollment period of 8 months to sign up for Medicare Part B without any late penalty. 8 months from the day your employer coverage ends. This is your window and you must act within it. Here is the most important warning about the Special Enrollment Period. Do not wait for your employer coverage to end before you start the Medicare enrollment process. Start the paperwork and applications 1 to 2 months before your coverage ends. Medicare enrollment is not instant. There are processing times involved. Starting early guarantees no gap between your employer coverage ending and your Medicare beginning. There are 2 more enrollment periods every senior needs to know about. The first is the General Enrollment Period. This runs every year from January 1st through March 31st. If you missed your initial enrollment period and you do not qualify for a special enrollment period, this is your annual second chance to sign up for Medicare Part B. However, signing up during general enrollment means your coverage does not begin until July 1st of that year. And yes, the late enrollment penalty still applies. The second is the Annual Open Enrollment Period for Medicare Advantage and Part D plans. This runs every year from October 15th through December 7th. During this window you can switch Medicare Advantage plans, switch Part D drug plans, go back to original Medicare, or make any changes to your current coverage. Whatever changes you make during this window take effect on January 1st of the following year. This October to December window is the most powerful tool available to existing Medicare enrollees. Used correctly, it can save you hundreds of dollars every single year by making sure your plan matches your current health needs and medication list. Used incorrectly, or ignored completely, it costs you money you did not have to spend. Here is something that shocks almost every senior who finds out about it. There is a 5th enrollment period that was created recently and most people have never heard of it. It is called the Medicare Advantage Open Enrollment Period and it runs from January 1st through March 31st every year. During this window, if you are already enrolled in a Medicare Advantage plan and you are unhappy with it, you can switch to a different Medicare Advantage plan or go back to original Medicare one more time. This is your safety net if you made a choice during October enrollment that you regret. Most seniors sit unhappy in the wrong Medicare Advantage plan for an entire year not knowing they had until March 31st to make a change. Now you know. And knowing this could save you from being trapped in the wrong coverage for 12 long months. Let us bring everything together. You have 5 enrollment periods to remember. Your initial enrollment period, 7 months around your 65th birthday, is the most important one. Miss it without qualifying coverage and you pay a permanent penalty every month for life. Your special enrollment period protects working seniors with employer coverage. The general enrollment period from January to March is your annual second chance. The annual open enrollment from October 15th to December 7th lets you change your plans every year. And the Medicare Advantage open enrollment from January to March gives you one final chance to fix a bad plan choice. Write these dates down. Put them in your calendar. Share them with your family. Because the government is not going to remind you. Your insurance company is not going to remind you. And your doctor is not going to remind you. If this video helped you, please give it a thumbs up and share it with someone you know who is approaching Medicare age. You could literally save them thousands of dollars and years of unnecessary penalty payments just by sharing this video today. Subscribe to Medicare Made Simple, because tomorrow we are covering something that affects every single person on Medicare: how to read and understand your Medicare summary notice so you can spot billing errors that cost seniors billions of dollars every single year. That is a video that could put real money back in your pocket. I will see you in the next one. This video is for informational purposes only. It does not constitute medical, legal, or financial advice. Medicare rules, costs, and enrollment periods change annually. Always verify current information at medicare.gov or speak with a licensed Medicare advisor for your personal situation.